My name is Caroline Verbeke. I'm a pathologist. And in the last 22 years, I think, I have been working exclusively with pancreatic disease and first and foremost with pancreatic cancer. For those who are not in the medical business, a pathologist is the doctor who examines tissues and cells from anything like large surgical resection specimens or tiny biopsies from the pancreas. Besides that, I'm also engaged in research at the national and international level. I'm a true European. I have been working in 5 different European countries. And in 2015, I moved to Norway. And that's where I met marvelous people, highly motivated. And together with them, we founded a advocacy group, a pancreatic cancer organization called the Norwegian Pancreatic Cancer Network. That was in 2016. I can't quite remember how I heard about PCE, but I am aware of its launch in 2014, I think it was. And so in late 2016, when the Norwegian Pancreatic Cancer Network was founded, we immediately applied for membership because we were very eager to be a member of the PCE. So we are members since 2016. Since we are a young organization, actually in November this year, we're going to mark our 5th anniversary. It's still very young. So it's very important for us to find support and inspiration from other pancreatic cancer advocacy groups. And obviously PCE is an umbrella organization. So it gives us the opportunity to contact, to hear, to work together with our, let's call it, sister organizations in Europe. So that's very important for us. The other thing that is has been very beneficial for us is the printed and electronic material that the PCE provides. For instance, the brochure with signs and symptoms of pancreatic cancer, which PCE has developed. We have simply used it, translated it into Norwegian, printed it, and then distributed it to GP offices on a national basis. So that has been very important for us. And last but not least, the information we got in our early days about how to seek contact with important stakeholders, how to try and find out what are the cancer strategies in your country and what is in place for pancreatic cancer, all of that, how to raise awareness. All of that has been very, very important and positive for us. Well, obviously, it is important that there is an advocacy group at a European level to raise political awareness and support. And since the headquarters of PCE are in Brussels, it's obvious and it's very important that the activities first and foremost focus on lobbying at the level of the European Parliament. It's very important to put pancreatic cancer on the agenda, the political agenda, and to raise awareness that pancreatic cancer has been completely neglected over the last so many years, and that it needs focus, that it needs to be prioritized. It has to be part of all the cancer-related policies. And this political lobbying and sort of active information we get through PCE about European policies, cancer-related policies, are of course very important. Is very important information for us and gives us much tailwind, something we really need. Second, it's very important for us to hear through PCE about policies or changes or practices that have been implemented in other European countries, and that we can communicate to our national stakeholders, to the Ministry of Health, to say, well, this is a good initiative. Why don't we follow this? In this global world, positive competition is very important to increase the political will to change policies and practice. So that's very important to us. And then, of course, PC is not only working, raising awareness, working at the political level, but it's also trying to foster research, trying to establish a registry, and all of that is, of course, very important for, well, the goal we all have in common to improve the prognosis for pancreatic cancer patients. We're only small and young, but what we can offer is our full support. And I suppose that is important. The more members, obviously, PCE has, the stronger its position and the stronger, the larger lever it has on its activities and on political lobbying. We can share our experience. We're not the only national organization that's in a sort of startup phase, so we can share our experience. And of course, we are very eager to support any activities PCE is undertaking. Wherever we can help, we're very happy to do so. I have no remarks, but maybe just a small anecdote, if I may. We had founded the Norwegian Pancreatic Network, and we weren't sure how to go about raising awareness, how to contact politicians. Yes. We had an acquaintance who was involved in the Norwegian Parliament, and she told us, well, we have this database. All the parliamentary debates are, of course, recorded verbatim, and you can search this database. And you can see how many times the word pancreatic cancer has been mentioned in the last so many years, and compare it, for instance, to the frequency the word breast cancer has been mentioned. And so we looked at that, and pancreatic cancer had been mentioned over the last, I think we looked at the past 8 years. It had been mentioned less than 10 times, and always in conjunction with other other cancer forms. Whereas breast cancer, I can't remember the exact number, but it had been mentioned, I don't know, 100-folds more often. So in all its simplicity, that finding was actually quite revealing, quite shocking. And it was very easy to present that to politicians and say, isn't that maybe something we need to change? We need to focus, we need to discuss pancreatic cancer. So that was a sort of positive experience, unexpected for us. Small things one can do with some effect.